Ischiofemoral ligament. The ischiofemoral ligament is a relatively weak ligament and it supports the joint posteriorly. It is attached to the ischium and posterior inferior part of the acetabulum. And these fibers from the ischium, they spiral behind the neck and get attached to the greater trochanter deep to the lateral band of the iliofemoral ligament. So these fibers which are spiraling superolaterally, they merge with the zona orbicularis, that is the inner circular fibers of the fibrous capsule. That's how the zona orbicularis, it gets constricted, gives an hourglass appearance to the joint cavity as these spiraling fibers of the ischiofemoral ligament, they get blended with the zona orbicularis. So this pubofemoral ligament, it prevents hyperextension by holding the head within the acetabulum. The transverse acetabular ligament, this one. This bridges the acetabular notch. This is the horseshoe shaped or lunate shaped acetabulum, the articular surface, and this transverse acetabular ligament, it bridges this acetabular articular surface, bridging the gap between the acetabulum, converting it into a proper socket, and this blends with the base of the ligament of head of the femur. The transverse acetabular ligament, it blends with the base of the ligament of head of the femur, through which the vessels pass on to supply the head of the femur. And this transverse acetabular ligament is devoid of cartilage cells. The acetabular notch thus becomes converted into a foramen here, which transmits the acetabular branches of the medial circumflex and the obturator arteries and nerves. So the round ligament of head of the femur, it is also called as ligamentum teres femoris, or the ligamentum teres of the head of the femur, ligamentum capitis, as it is attached to the head. Capitis means head, capit is head. So this is also a flat triangular ligament with its apex that is attached to the fovea capitis, that is the fovea of the head of the femur, and its base is whitened and is blending with the transverse acetabular ligament. So this round ligament is ensheathed by the synovial membrane. Here you can see this is the ligament of head of the femur, which is triangular in shape, the apex and the base. The apex is attached to the fovea of the head, and the base, it gets blended with the transverse acetabular ligament. It has no role in the joint stability. It will only transmit the arteries, the foveal artery, which are derived from the acetabular artery, which are the branches from the obturator and medial circumflex femoral arteries, through the fovea between the acetabulum and the transverse acetabular ligament here. It is stretched in adduction and is relaxed in abduction movements. The injury to the ligamentum teres can occur in dislocations which will restrict the arterial supply to the head of the femur, resulting in osteonecrosis of the femoral head. So now bursae around the hip joint. There are about 7 bursae around the hip joint approximately. 4 under the gluteus maximus, where one is between the gluteus maximus and the ilium, being located between the posterior curved part of the outer lip nearer the iliac crest here. So this is the gluteus maximus, which is cut. This muscle goes like this. Okay. So these are the 4 bursae which are related to the gluteus maximus. So this is the one between the gluteus maximus and the outer lip of the iliac crest on the posterior aspect. And then there is another bursa which is called as trochanteric bursa at the lower part of the outer aspect of the greater trochanter, where it is between the gluteus maximus muscle and the greater trochanter. And there is an ischial bursa here, which is between the gluteus maximus and ischial tuberosity. Okay, this is how the gluteus maximus muscle. So it is between the gluteus maximus and the ischial tuberosity. And this is the gluteofemoral bursa, which is between the gluteus maximus and the vastus lateralis. That is the even iliotibial tract also is there. Between gluteus maximus, iliotibial tract, because few of the fibers of the gluteus maximus, they get blended with the iliotibial tract. So this is between the gluteus maximus, iliotibial tract and the vastus lateralis. So one is under the gluteus medius muscle. This one. The one is under the gluteus minimus muscle. And this one, which is called as psoas bursa. The psoas major muscle is coming like this. This is the iliacus muscle here. This part of the hip bone. Here it is the psoas major muscle which is coming down, and it gets inserted onto the lesser trochanter, the iliopsoas tendon, right? So somewhere here at the iliopubic eminence, between the psoas major muscle and the iliopubic eminence, there is this bursa which has usual characteristic feature of communicating with the joint space. Between the iliofemoral and pubofemoral ligaments, there is this subpsoas bursa or the psoas bursa, which is having communication with the joint cavity, the bursa of the joint cavity, the synovial membrane of the joint cavity. What are these bursae actually? They are the fluid-filled pockets. They develop wherever the tendons or the ligaments, they are rubbed against another tissue to reduce the friction, like this medius and minimus tendon. In between there is this bursa, the gluteus medius bursa. Between the minimus and the greater trochanter here is the minimus bursa, like that. So these bursae can get infected. So the subgluteal bursa here, usually the ischio-femoral bursa, which is between the gluteus maximus and the ischial tuberosity, the ischial bursa, it can get inflamed and enlarged in people who have long period of sitting, like the weavers, where they sit, and there is constant movement of their legs, and there is friction that is created between the gluteus maximus, the lower fibers of the gluteus maximus, and the ischial tuberosity there. So there can be an inflammation of this ischial bursa, which is called as weaver's bottom. It's not just in the weavers that is seen. The people who are accustomed for long hours of sitting also may have this ischial bursa being inflamed. Relations of the hip joint. So the anterior relations are the tendon of iliopsoas. The tendon is present anterior to the joint. So this is where is the psoas bursa at the iliopubic eminence between the tendon of psoas major here. So that is where is the psoas bursa also, that is related anteriorly. Then it is the pectineus, more so the lateral part of the pectineus, which also forms the floor of the femoral triangle here, which is in front of the hip joint. The lateral part of the pectineus forms the anterior relation, and the straight head of the rectus femoris also forms the anterior relation. And here you can see this is the femoral nerve, this is the femoral artery, this is the femoral vein. So the femoral nerve, which is between the iliacus and the psoas tendon, here you can very clearly see this is the psoas tendon and the iliacus. So as this descends down here, is also related anterior to the hip joint, and the femoral artery is in front of the psoas tendon, and the femoral vein is in front of the pectineus. So this neurovascular structures along with the muscles, they are all related anteriorly. Coming to the posterior relations, the piriformis muscle, this one, the obturator externus, the obturator internus, along with the superior and inferior gemelli muscles, and the superior gluteal nerve and vessels above the piriformis, and inferior gluteal nerve and vessels below the piriformis, the sciatic nerve, the posterior cutaneous nerve of thigh, and nerve to quadratus femoris. These are all related posteriorly. The piriformis is considered as the key muscle of the gluteal region. So I repeat again, the muscles which are in relation to the hip joint posteriorly are, this is the obturator externus, this is the obturator internus with superior and inferior gemelli muscles, this is the piriformis, and the superior and inferior gluteal nerve and vessels, and the sciatic nerve, the posterior cutaneous nerve of thigh, and nerve to quadratus femoris, and over which it is the gluteus maximus also, which is related posteriorly. And the muscles that are related superiorly. So this is the rectus femoris. The straight head is from the anti-iliac spine, and the reflected head is above the acetabulum. So it is the reflected head of the rectus femoris which is related superior to the joint, along with the gluteus medius and minimus muscles and the gluteus maximus laterally. These are the things, superior relations. The reflected head of rectus femoris, gluteus minimus, medius, and the gluteus maximus. Inferiorly, it is the pectineus, you can see here, the medial part of the pectineus, and the obturator externus. This one. So inferiorly, there is this pectineus and obturator externus. Posteriorly, it is the piriformis, then it is the obturator internus with superior and inferior gemelli muscles, quadratus femoris, over which is the gluteus maximus. So we do find the vessels above and below the piriformis. So we have the superior gluteal vessels and nerves above the piriformis, inferior gluteal vessels and nerves, sciatic nerve, the posterior cutaneous nerve of thigh, and also nerve to quadratus femoris. All these structures are related posteriorly. Anteriorly, it is the straight head of the rectus femoris and the tendon of the iliopsoas, where there is this psoas bursa between the joint and the iliopsoas tendon, and then it is the pectineus, where the lateral half of the pectineus is related anteriorly, the medial half is related inferiorly here. So it is the femoral nerve, vein, artery and vein are also related anteriorly between the iliopsoas tendon, in between, in front of the psoas tendon and in front of the pectineus. So this diagram, if you draw for the relations, is fine, and you should be drawing this diagram for the relations of the hip joint. Hip joint being a multiaxial joint, it permits flexion and extension along the transverse axis. This one. Flexion, extension around the transverse axis or the lateral axis. And the abduction, this one, and adduction around the antero-posterior axis. And here the medial rotation and the lateral rotation, or the internal rotation and the external rotation, are done around the vertical axis. So flexion. So when the thigh is brought nearer to the abdomen, that movement is flexion. And the flexion with extended knee is limited to about 90 to 100 degrees. And this range of movement is extended to 120 degrees with flexed knee. And the flexion is limited by the anterior abdominal wall. In passive flexion of hip, until the thigh meets the anterior abdominal wall, there is some degree of flexion of the vertebral column as well. And this flexion will make the joint loose packed one, and the capsule is relaxed. And the muscles that are responsible for the flexion are the iliopsoas, which are the chief flexors of the hip joint. It is the pectineus, adductor longus, and the one behind that is the brevis, and the rectus femoris, as well as the sartorius. Extension. So this extension is limited when the thigh and trunk are in vertical line. The range of extension beyond the vertical line is about 10 to 20 degrees. only because the further extension is restricted by the iliofemoral ligament. And during extension, the joint becomes close packed. And the muscles that are responsible for the extension are the hamstrings for the first 10 degrees, that is the long head of the biceps, the semitendinosus, semimembranosus, and the hamstring part of the adductor magnus, as well as the gluteus maximus. So the gluteus maximus contracts against resistance. That means when a person is raising the trunk from sitting position or in climbing upstairs. Hamstring muscles, they maintain the normal standing and walking. Adduction. So the movement of the thigh medially is adduction, that is crossing one thigh over the other. It is limited by the lateral portion of the iliofemoral ligament, and the muscles that are responsible for the adduction are the adductors, the medial compartment muscles, that is the adductor longus, the adductor brevis, and the adductor magnus, the whole length which has been cut here to show the other muscles, and the pectineus and the gracilis and the obturator externus. So all these muscles, the adductor compartment muscles, are responsible for adduction. The range of the movement for adduction is about 25 degrees. Coming to abduction, moving the lower limb away from the midline is abduction, and this abducting movement is restricted by pubofemoral ligament, and the muscles that are responsible for the abduction are the gluteus medius, minimus, the tensor fasciae lata, this lateralmost structure here is the tensor fasciae lata, and the sartorius. And the range of movement of abduction is about 40 to 50 degrees.